It's another bright and beautiful day in the dwell in the savannah. Welcome to another ride on Gombe's transformative journey. We start off this week with a review of major events during the past week, and after which we're going to be focusing our spotlight on the transformation in the health sector in Gombe State. But specifically, we'll be looking at the Gombe State Specialist Hospital and how it has been transformed from a total state of disrepair in just a few years to a modern, efficient health center that everyone can be proud of. I am Landry Adeyemi. I bid you welcome. The Supreme Court affirmed the 2023 Gombe State governorship election victory of the All Progressive Congress and its candidate Inuwa. The judgment delivered by Justice Kudirat Kekereekun affirmed the decision of the Court of Appeal while dismissing the appeal filed by the PDP and the ADC. Governor Yaya, in his reaction, urged other contestants and political leaders to join him in his quest to transform Gombe State into a haven of inclusive development and shared prosperity. A special committee set up by the Gombe State government to review the capital city's development master plan submitted its report during the week. The new Gombe City Master Plan targets a return to the 2004 design while projecting for the next 10 years. As Gombe City continues to grow in landmass, population, and infrastructure, the state government is conscious that all these have to be properly managed to secure the future. The strategy is visionary planning, monitoring, and enforcement.
Sheer neglect is what caused us to be where we are today. Neglect, especially by the officials of government and operators of government, from head to toe. I cannot exempt anybody. The Honorable Commissioner, AIG, mentioned that to us now. So we have no alternative. There is no way. It's either we allow this planless life to come and engulf all of us, or we change and go for a better planned life that will provide the space for each and every one of us, and indeed the generations that are yet unborn, to come and enjoy the life that will be good for them.
Also, the Nigerian Immigration Service launched a special operation to protect the country's borders with the Republic of Cameroon, Chad, and Niger. The operation, codenamed Saronyaka, aims to curb irregular migration and the recruitment of fighters for terrorist and bandit groups. The Assistant Controller General in charge of the frontline states of Borno, Yobe, Adamawa, and three other states of Gombe, Bauchi, and Plateau announced the special region-wide operation after meeting with regional leaders.
We know it is alleged that in Nigeria we have so many illegal migrants. Even though by the ECOWAS protocol it is a free movement of goods, persons and services, it must be a legal movement. You are very much aware of the incident that happened in Ibadan day before yesterday. Although it is not yet confirmed, but it is highly speculated that it was the illegal migrants that came again and engaged in illegal mining. And see that blast. See how many lives were lost. See what property we have lost.
We are also sent by directive and mandate to ensure that any person that's traveling out of the borders of the Northeast travels with a valid travel document. We are also to ensure that there's no infiltration of non-Nigerians into Nigeria through the Northeast. And we are also to ensure that Nigerians traveling through the Northeast are traveling through approved routes. And by extension, investment drives in the Northeast is supposed to be driven by the Nigerian Immigration Service, because we give visa for every perceivable condition: business, visit, transit, hospitality, visit, and other things that you know. And we are also part of the security architecture of this country, because we have immigration officers that have been in the Joint Task Force for more than 10 years in the Northeast.
Those are some of the major events during the week.
Specialist Hospital Gombe was established in 1958 with new facilities added over the last 6 decades. By 2019, when the administration of Governor Inuwa assumed office, the hospital was in complete state of disrepair.
Majorly, the hospital was comatose. Virtually, we were not discharging our mandate because this hospital is supposed to perform 3 functions: service delivery, training, and research.
Because of his deep passion for quality healthcare, immediately after taking the oath of office, Governor Inuwa went to inspect facilities at the State Specialist Hospital and made first-hand assessments. It was simply heartbreaking. Without stable electricity, many patients had to sit or lie on the floor. The wards were overcrowded and the personnel were stretched thin because of inadequate manpower. Almost every aspect of the hospital was deficient.
Equipment that are used are supposed to be sterilized here. This is just an improvised structure. The ideal thing is a machine which is an autoclave that operates at a temperature of 121 degrees Celsius. But these machines just boil. Maximum it can go is 100 degrees, meaning any microorganism that cannot die within that 100 degrees will not die, because the ideal one is 121 degrees Celsius.
So you don't have an outlet?
We don't have an outlet in this area. And then the light, because sometimes, you know, we can have accidents, so many people here, but then we don't have light. It's a major challenge. In this place, we may need to have some service. Yes, sir, but the generator, the diesel, the fueling is a big challenge.
Are you not giving other charges, finance, normal?
Well, I didn't know what is happening now. There is a company that usually supply the diesel, but the supply is very erratic. And the hospital has...
So how much does the hospital pay as regular maintenance allowance?
So what we receive is 380,000 naira per month.
Per month?
Yes, to take care of the diesel, to take care of ambulance, fueling.
And how regular? That was
It's not regular.
one last
I think we received last one in the last 3 months.
Honestly speaking, they lack a lot of things more in the clinic, more especially when you go to the wards. The wards are not something to write home about. And when it comes to we go to maternity, especially maternity, where they give birth to children. Sometimes you find women that want to give birth, there is no bed space for them.
I've gone around the hospital, particularly the accident and emergency unit, the pediatric unit, and the maternity, where we saw how the women are suffering. We've seen the level of decay, and I've confirmed the shortfall of staff there. Is affecting the operation of the hospital. But most importantly, lack of adequate power, because there's no effective supply or allocation of the monthly, amount of money that they need in order to run the hospital efficiently. And they've told me that on the average, they treat close to 21,000 patients in a month. So it's not an easy thing. But inshallah, this government will do its best, and I guarantee to the people that very soon they will see positive change.
Rather than curse in the darkness, Governor Inuwa decided to switch on the lights. He started by ensuring a steady electricity supply to the hospital. New electricity generators were purchased and solar panels with inverter systems were installed.
We're using torchlight before and lantern. So we appreciate the government for providing solar system for us. Now we can run shifts morning, evening and night.
He replaced those obsolete equipments. He replaced the generator. He also introduced solar system. Now, if you go to essential areas, meaning labor room, theater, laboratory, they're all on solar. So that there's 24/7 inverter system, 24/7. You get electricity there because they are critical places, labor room, emergency pediatrics, theater, the accident and emergency unit. These ones are on solar. Then he also supported the wards, those critical site of the wards, they're also, then the security lights along the place is also all on solar. So, but we also have standby gen. The standby gen also charges the inverters, and also sometimes when there's no adequate sunlight, maybe during rainy season, the cloud cover is the light is, we're on the gen.
Next was the construction of critical infrastructure. The resident doctors' housing complex was built and fully furnished. The entire road network in the hospital was refurbished and the wards were renovated. The administration also supported the hospital to gain accreditation for postgraduate training in family medicine, obstetrics, and gynecology.
The sector that was neglected most in Gombe State was health. And for us, health is number one. We came with a focus, and a clear vision, to change the fortunes of the people for the better.
Several years ago, when Gombe State was created, we came in from Bauchi, and the specialist hospital then was called a general hospital in Gombe. And it was the only general hospital. I mean, Kaltungo, Bajoga, other ones were there, but it has the highest number of patients coming in and facility. Now, we want to start internship training. For 26 years, the doctors that came from Gombe State had to go elsewhere to do housemanship training. So we now said, let us improve the specialist hospital to bear the name specialist, where you would have the accident and emergency unit, the medical ward, the surgical unit, the pediatrics unit, the obstetrics and gynecology. All these specialties have to come in and then recruit consultants. And we have a medical school, the Gombe State University. The College of Medicine is there, and we're producing doctors. And these doctors need a place to do their internship, which is compulsory before they are licensed to practice. So to get that, His Excellency said, we need to have a standard facility that will, one, provide training, two, improve service delivery for the people of Gombe State. And that was the genesis.
I'm supposed to start by thanking the state government for making it possible for us to do our housemanship here, because for example, some people graduating in other universities that were not under the sponsorship, some may even spend like 2 to 3 months without even having a placement where to do their house job. Just 2 days after our induction, the arrangement for our internship is already on ground. So we are to report the second day, and we reported the following day. So it's actually a kind of a very smooth transition from studentship to internship.
It's actually an opportunity for us to be the first set of interned doctors in this facility. We are actually grateful to the government.
What we encountered in the past years, 10, 15 years ago, today is no longer the case.
In every hospital, the accident and emergency unit and the general outpatient department are the first point of call. The Inuwa administration built ultra-modern, fully furnished connected GOPD and AE buildings, fully equipped with extra bed capacity, multiple consulting rooms, treatment rooms, and a dedicated pharmacy and laboratory. New staff were also engaged to boost manpower and quality service.
If you come to any hospital, you now first of all want to look at the accident and emergency because it is an important component of the hospital. At that time, what we had was something like just a small chemist, just a hall and with 2 rooms only, where people come in when they sustain injuries, particularly head injuries, fractures. They will move in. The situation was bad because at that time you have to maybe see the patient, you write the drugs or medication, the relative have to rush out to get those medication because we don't have a functional pharmacy in the A&E. And we don't have any laboratory.
The accident of emergency, is a triage. And Gombe is on a highway connecting Yola, connecting Bauchi, connecting Bono. We have a lot of accident cases. So when you need to have a triage where you come and solve these cases and refer and then attend to them. So we now said, let us have a befitting A&E unit, story building with office structure, conference rooms, and consulting rooms, even beds, side laboratories, side radiology units, side theater, minor theater. Then when you sort them out, you now take them to appropriate units. It's not just about the accident and emergency unit. We now said the obstetrics unit, the labor room need to be improved. We improved the labor room by bringing in more delivery beds, more beds at the first stage and second stage room, antenatal ward. Then we also attach a theater in case there's a woman requiring cesarean section or emergency obstetrics or gynecological disease. You don't need to go to the main theater. You just wheel her into that theater attached to the labor room. Then you go to the emergency pediatric unit, which we also enhance to attend to emergency cases in pediatrics. We also, the laboratories, whatever you're doing, the doctor has to send in certain things to confirm his diagnosis. You need to do some investigations, bedside and other things, to make informed decision and take confirmed diagnosis. So we now improve the laboratory. Then the wards. Equally, the medical ward, the surgical ward, initially they were smaller in number. We needed more bed space. So we had to now expand the wards. So the wards, then we had a renal unit where we're doing dialysis. We brought in dialysis machine. Then we have rehabilitation centers where we have physiotherapy and rehabilitation. In post-operative, you need to do that. Post-paralysis, you need to rehab people to do things. Post-delivery, you need to develop the pelvic floor muscle. So you need place where you will do rehabilitation for patients that have that have been lying on bed for quite a time. So we now established a physiotherapy unit and rehabilitation. We also have the radiology unit where we have the X-ray machine, the ultrasound machines, and other things to help diagnose cases.
The coronavirus pandemic jolted the whole world and put a significant strain on healthcare infrastructure. As challenging as the pandemic was, it also had its unintended benefits. The global health emergency drew attention to the health sector and ensured more investments in training, infrastructure, and equipment. Gombe State was not left out. A molecular laboratory was built at the specialist hospital, and a new isolation ward with ventilators was also erected and equipped.
I commissioned this infectious disease hospital to serve as an isolation center for COVID-19. To the glory of Allah subhanahu wa ta'ala and for service to humanity.
Officials of the Nigeria Center for Disease Control, NCDC, commended the extraordinary vision of the Gombe State government.
We now had to expand part of specialist hospital, the old laboratory, we expanded it to put in a molecular laboratory there. Now we started testing in Gombe, and we started reaction in Gombe. Not only the molecular lab, we established isolation centers. We have one in Kaltungo, General Hospital to take care of the southern wards, Biliri, Kaltungo, Shongom, and southern part of Balanga. We also had another one in Bajoga, and we partnered with Ashaka Cement Factory. We got all the equipment required at the ICU, Intensive Care Unit and Isolation Center in Bajoga to address cases from Nafada, Funakae, Duku, and so on and so forth. Even those from Yobe were coming into that facility. Then in Gombe here, we had the Federal Teaching Hospital and the Specialist Hospital. Then in the course of time, because of the large numbers, we now said we'll do an infectious disease hospital, and we have another isolation center in Koda. There, you know, now the human resource question has come in because we need more people that are trained, especially in infectious disease. The structure we got from COVID now help us to address issues of Lassa fever, even the current diphtheria. There's diphtheria now. If you see our neighbors, the mortality in Bauchi, the mortality in Yobe, so huge. But Gombe is, listen, and we share border with Bauchi, we share border with Yobe. And you know, because intermarriage and other social gatherings and this, we come, we interact. But our structure, the incident management system and the structure we inherited from COVID was still active. So we could do more surveillance. We could do, we have treatment centers, and we have drugs that we are giving out to those case management. Once we get a case, we treat promptly so that spread becomes less because we are isolating the patient and treating on time. But if you leave him into the community, he keeps spreading the infection, and the mortality will still be high.
A lot of hospitals are being renovated. Family primary health centers are being renovated in each and every ward. That the primary health care in the local government at the local government level has been brought under the state to ensure that there is proper dispensation of health and attention given to health as is required.
The marked improvement in infrastructure and service delivery is attested by both patients and the management of the hospital.
For the first time in the history of Gombe State, they now can absorb house officers in the specialist hospital. And I think the vision, and I think I'm seeing in that place is that it's supposed to serve in the future teaching hospital for Gombe State University, the state teaching hospital. And I think it's in that pipeline to accomplish that. And I'm very sure very soon they're going to start other training of resident doctors, and that will help to keep some of the doctors, you know, who are working with the state on ground to also contribute in the healthcare of the state.
The revived specialist hospital Gombe is now a model for other states to emulate and a true testament to the integrity of Governor Inuwa, who promised to revamp the facility. He has not just fulfilled his promise, but has gone over and above to establish a lasting legacy.
An average of 25,000 patients are treated every month in Gombe Specialist Hospital. All these because of compassionate and visionary leadership in Gombe State. Do join me again next week for another exploratory journey on Gombe's transformative journey. But before then, you can watch this episode and others on our social media platforms. I am Landry Adeyemi.